أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين، والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه أجمعين. أمسينا وأمسى الملك لله والحمد لله لا شريك له، لا إله إلا هو إليه النشور. أصبحنا وأمسينا وأمسى الملك لله والحمد لله لا شريك له، لا إله إلا هو وإليه النشور. أمسينا على فطرة الإسلام وعلى كلمة الإخلاص وعلى دين نبينا محمد صلى الله عليه وسلم، وعلى ملة أبينا إبراهيم حنيفا وما كان من المشركين. اللهم إني أمسيت منك في نعمة وعافية وستر، فأتم علي نعمتك وعافيتك وسترك في الدنيا والآخرة. اللهم ما أمسى بي من نعمة أو بأحد من خلقك فمنك وحدك لا شريك لك، فلك الحمد ولك الشكر. اللهم رضيت بالله ربا وبالإسلام دينا وبمحمد صلى الله عليه وسلم نبيا ورسولا. سبحان الله وبحمده عدد خلقه ورضا نفسه وزنة عرشه ومداد كلماته. سبحان الله وبحمده عدد خلقه ورضا نفسه وزنة عرشه ومداد كلماته. سبحان الله وبحمده عدد خلقه ورضا نفسه وزنة عرشه ومداد كلماته. بسم الله الذي لا يضر مع اسمه شيء في الأرض ولا في السماء وهو السميع العليم. اللهم إنا نعوذ بك من أن نشرك بك شيئا نعلمه، ونستغفرك لما لا نعلمه. أعوذ بكلمات الله التامات من شر ما خلق. اللهم إني أعوذ بك من الهم والحزن، وأعوذ بك من العجز والكسل، وأعوذ بك من الجبن والبخل، وأعوذ بك من غلبة الدين وقهر الرجال. اللهم عافني في بدني، اللهم عافني في سمعي، اللهم عافني في بصري. اللهم إني أعوذ بك من الكفر والفقر. اللهم إني أعوذ بك من عذاب القبر. لا إله إلا أنت. اللهم أنت ربي، لا إله إلا أنت. خلقتني وأنا عبدك وأنا على عهدك ووعدك ما استطعت أعوذ بك من شر ما صنعت أبوء لك بنعمتك علي وأبوء بذنبي فاغفر لي فإنه لا يغفر الذنوب إلا أنت اللهم أنت ربي لا إله إلا أنت خلقتني وأنا عبدك وأنا على عهدك ووعدك ما استطعت أعوذ بك من شر ما صنعت أبوء لك بنعمتك علي وأبوء بذنبي فاغفر لي فإنه لا يغفر الذنوب إلا أنت أستغفر الله أستغفر الله أستغفر الله الذي لا إله إلا هو لا إله إلا هو الحي القيوم وأتوب إليه سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك اللهم صل على سيدنا محمد عبدك ورسولك النبي الأمي وعلى آله وصحبه وسلم تسليما عدد ما أحاط به علمك وخط به قلمك وأحصاه كتابك اللهم صل على سيدنا محمد عبدك ورسولك النبي الأمي وعلى آله وصحبه وسلم تسليما عدد ما أحاط به علمك وخط به قلمك وأحصاه كتابك وارض اللهم عن ساداتنا أبي بكر وعمر وعثمان وعلي وعن الصحابة أجمعين وعن التابعين وتابعيهم بإحسان إلى يوم الدين سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه وسلم. Dear brother and sister and children, Assalamu alaikum wa rahmatullahi wa barakatuh. Assalamu alaikum wa rahmatullahi wa barakatuh. We welcome you all to our night UWMS Upper Westchester Muslim Society in Pleasantville, New York. And we have tonight with us, Brother Badr is going to continue with Surah Yusuf. And we are so fortunate to have with us Dr. Amir Mohammad. Inshallah, I'm going to introduce him after Brother Badr, inshallah. Brother Badr.
أعوذ بالله من الشيطان الرجيم قالوا إن يسرق فقد سرق أخ له من قبل فأسرها يوسف في نفسه ولم يبدها لهم قال أنتم شر مكانا والله أعلم بما تصفون قالوا يا أيها العزيز إن له أبا شيخا كبيرا فخذ أحدنا مكانه إنا نراك من المحسنين قال معاذ الله أن نأخذ إلا من وجدنا متاعنا عنده إنا إذا لظالمون فلما استيئسوا منه خلصوا نجيا قال كبيرهم ألم تعلموا أن أباكم قد أخذ عليكم موثقا من الله ومن قبل ما فرطتم في يوسف فلن أبرح الأرض حتى يأذن لي أبي أو يحكم الله لي وهو خير الحاكمين ارجعوا إلى أبيكم فقولوا يا أبانا إن ابنك سرق وما شهدنا إلا بما علمنا وما كنا للغيب حافظين واسأل القرية التي كنا فيها والعير التي أقبلنا فيها وإنا لصادقون قال بل سولت لكم أنفسكم أمرا فصبر جميل عسى الله أن يأتيني بهم جميعا إنه هو العليم الحكيم وتولى عنهم وقال يا أسفا على يوسف وابيضت عيناه من الحزن فهو كظيم قالوا تالله تفتأ تذكر يوسف حتى تكون حرضا أو تكون من الهالكين قال إنما أشكو بثي وحزني إلى الله وأعلم من الله ما لا تعلمون يا بني اذهبوا فتحسسوا من يوسف وأخيه ولا تيأسوا من روح الله إنه لا ييأس من روح الله إلا القوم الكافرون فلما دخلوا عليه قالوا يا أيها العزيز مسنا وأهلنا الضر وجئنا ببضاعة مزجاة فأوف لنا الكيل وتصدق علينا إن الله يجزي المتصدقين قال هل علمتم ما فعلتم بيوسف وأخيه إذ أنتم جاهلون قالوا أئنك لأنت يوسف قال أنا يوسف وهذا أخي قد من الله علينا إنه من يتق ويصبر فإن الله لا يضيع أجر المحسنين قالوا تالله لقد آثرك الله علينا وإن كنا لخاطئين قال لا تثريب عليكم اليوم اليوم يغفر الله لكم وهو أرحم الراحمين اذهبوا بقميصي هذا فألقوه على وجه أبي يأت بصيرا وأتوني بأهلكم أجمعين ولما فصلت العير قال أبوهم إني لأجد ريح يوسف لولا أن تفندون قالوا تالله إنك لفي ضلالك القديم فلما أن جاء البشير ألقاه على وجهه فارتد بصيرا قال ألم أقل لكم إني أعلم من الله ما لا تعلمون قالوا يا أبانا استغفر لنا ذنوبنا إنا كنا خاطئين قال سوف أستغفر لكم ربي إنه هو الغفور الرحيم صدق الله العظيم.
صدق الله العظيم. Dear brother and sister, just for information, I think you received, okay, that is this announcement now that we are live on your YouTube. Okay. And then I think you receive, okay, that is a connection there. We are so fortunate tonight to have with us Dr. Amir Mohammad. Yeah, okay, Dr. Amir is a board certified internist, occupational medicine physician, and public health physician, and the head of the Department of Health, Orange, okay, Connecticut. This is thank you, Brother Muhammad Hamida, for making this announcement, this arrangement. And we are so lucky to have with us Dr. Amir. Inshallah, he's going to, this is to, we sent him 17 questions. Okay, this coming from you, 17 questions, and he's going to answer these questions, inshallah. This will be also, if you have a few questions, that's also he can take, okay, inshallah. Okay. Dr. Amir.
Okay, assalamu alaikum. Can you hear me?
Yes, inshallah.
MashaAllah, very good prayers and dua. And may Allah keep us all safe and blessed. So, Bismillah ar-Rahman ar-Rahim. So basically, I'm going to recap and summarize some of the new information that we're receiving from various authorities, federal government, and public health government. So obviously, you are living in New York, which is one of the hardest hit state. And I will quickly, again, summarize my recommendation, and then we'll specifically ask all those questions. Okay. So what do we do with this pandemic? This April month is going to be very tough. We know from different sources, from the data that it's predicting, April is going to be very tough. We haven't reached the peak, meaning the peak is the highest number of cases of COVID-19 positive. And then inshallah, after the peak, the number of cases will go down. So it's highly contagious infection. Some states, are taking some aggressive measures. And the only thing or the only step that we can do is to prevent unnecessary travel. Okay, so staying put, staying at home is the most important remedy at this time. Okay, so we don't have any vaccination at this time. It will not come in a year or so, and also no appropriate or recommended treatment. So those folks who get admitted in the hospital are treated differently, okay, based on their presenting symptoms. Some of them may require intensive care unit, hospitalization where they are intubated for artificial breathing. So that's a severe case. So some of the medications that are basically on experimental basis. So that's what you need to know. Now, I also want to emphasize on the fact that folks in the community, whether it's Muslims, non-Muslim, and anywhere, if you know that they have some underlying health conditions, they are at most risk for developing complications. So what are these risks? Underlying health conditions, they have chronic kidney disease, problem with the kidneys, heart disease, like previous heart attack, stents, stroke, uncontrolled blood pressure, diabetes, uncontrolled diabetes, those who are former smoker or current smoker, some lung issues they may have like asthma, COPD, um, cancers, any type of cancer, and they are immunocompromised, so they are at most risk of developing complications for COVID-19. Um, so I think at this time we all have to take extra precaution. We have to help each other and remind ourselves, because this is our deen, this is our religion, that we have to take care of ourselves and our loved ones and family and neighbors and everybody. So for that, you need to implement both social and physical distancing. Okay, so what are the common practice? Mashallah, we already practice it by doing wudu 5 times a day, cleaning your exposed areas, okay, washing hands, face, all very good. we knew we knew that almost 1400 years ago, mashallah. So we just have to keep practicing. Avoid any touching of your faces and exposed areas. You must stay at home, avoid any gatherings, any get-togethers. Okay, and as I said, traveling unnecessary. So by that I mean, yes, if you have to go to the grocery store once a week, you should do that and where appropriate. And I'll go into that. There's some new guidelines coming up that you must put something on your face. It could be a scarf or mask or something, not a medical mask. I don't want you to take an idea that N95, those respirator that are highly specific for protecting yourself, those are used by the medical personnel because they get fit tested. If somebody goes out and buy N95, it's useless pretty much, because you have not been fit tested. When we work at the hospital, we have to go through the special fit testing, meaning we need to get the right fit based on our facial features, beard, and all that. And then we are given appropriate mask to wear when we are treating the patient. So that's the number one thing that people should remember, that those medical masks N95 are not for common general public. Okay, yeah, if you are going to the grocery store, for example, Costco, major areas where you can find some crowded environment, make sure if you are covering with a cloth mask or scarf or anything just to protect yourself, that's meaning to discourage you to keep on touching your face. That's what it does. Okay, obviously you have to follow the social distancing, 6 feet. Okay, so if somebody's sick, they are not coughing on you, and even if you're wearing any type of surgical mask or cloth mask, the droplets or infection can go through that. Okay, so keep the distance. Again, avoid any unnecessary travel. If you can get things online, do that. Order online, get it dropped outside your door, and then follow all type of precautions. Okay, so I'm going through my notes and then I'll start answering the question. Right, so I'm hoping that nobody's traveling unnecessary and keeping a good distance, praying, spending some time in deen, learning about religion. Okay, so let me go to the questions. Question number 1, is COVID-19 transmitted through food? No. So that means what my understanding is, if you're eating food and somehow it is contaminated, mashallah, we have some of the acids and enzymes in our digestive system that breaks down all this virus. So there's no report to suggest that this infection can transmit it through the GI tract or through your mouth. It can only go through the nose, through the respiratory tract, and that's how it causes problem. Some of the early signs of this infection could be loss of taste, smell, besides fever and chills, nausea, vomiting, some folks have come up with red eye and itchy eye because of viral infection. So any type of viral infection can cause your upper mucosa, upper mucous membrane of your body. Um, will it be better in hot weather? We don't know. There are other countries that they have warmer temperature and still this virus got spread out. So inshallah, hopefully things will get better as we hit the peak, but it's still very much unclear as to when it will be better in hot weather or not. Okay, but heating, boiling, you know, does disrupt the viral morphology. So inshallah, hopefully hot weather will calm it down, but we don't know for sure. Therefore, precautions must be carried out, at least for now. Anti-malarial drugs are being used as an experimental basis and under supervised condition. So meaning one should not, even if you have received this medication from outside the US or any other sources, one should not take it. We have heard some cases that people have died. It has a lot of side effects. Okay, so please, 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 anything that sounds like chloroquine, hydrochloroquine, do not use it. Absolutely not. It's not indicated. It's not going to do any good. Okay. Recommendation about vitamin C or D. What I say that is, if sorry, I have to tell my kid. So vitamin C and D, if you have deficiency, then it's needed. But mashallah, if you have a balanced diet, you eat fruits and vegetables, you get plenty of that. Okay. So I already answered about the grocery. If it's an urgent, necessary, once a week, you can go there. A lot of stores are giving you wipes to clean the cart, the handle of the cart, minimize the touching. And when you bring the grocery back home, you can wipe the outer surface, the boxes, discard the box, just use the inner covering or inner lining. If it's a cereal bag or any other thing, you must wipe the outside surface, and that should be good. The black seed oil, I don't know for sure. I've read few of the notes. I am a big fan of eating healthy and balanced diet. So if you have this black seed, it's not a cure or anything. If you have it available, use it. There's no harm, inshallah. Okay, so how long do you predict we will be locked up like this? Okay. Well, don't think in a negative term. I know some businesses are being hurt, but the only thing the scientists have determined is, in the other countries, when they took extreme measures and limited the spread or traveling in the community, we were able to get a control of this infection, especially in South Korea and China, that they put some strict measures. They had, curfew type of situation. So we think of this time as, remembering other things, modifying your lifestyle, being more creative, inshallah, focus on learning, your deen, to spend it wisely. I think at least this, president and his administrative staff has already said by the end of April. So we'll see how things will be. Okay. Do we need to wear masks if we're going to supermarket? I already mentioned that. Yes, first of all, if you are sick, you should not go. Okay. If you're feeling any symptoms, you must avoid going out. So let somebody else go. Only one person in the family should go. I already mentioned about disinfecting your groceries. In terms of mail and boxes, it's a paper. If you are wearing any gloves, open the mail and then throw out the glove. If you are not, then just wash your hands. Obviously, nobody's touching the mail through the eyes or skin or any of that direct contact. Just rip the envelope and then wash your hands. That should be fine. Face mask, I've seen folks, one of my colleagues made a cloth face mask. If you know how to do it, just any scarf, any cotton mask, it's not going to protect you from somebody coughing onto you who has COVID positive, but it can help you with you as a reminder not to cough to touch your face when you're out there. Okay. Checking temperature on a daily basis. If you have a thermometer, you can check it, no problem. If you are having symptoms, if you've been told by the doctor that you may have been exposed to somebody who had infection, then yes, you have to check your temperature twice a day. And I'll go into that in the last 5 minutes when you what to do in situation where you have somebody in your family or friends who had been tested positive. Sleeping time, less and less, how to deal with anxiety. I know it's a tough time, brothers and sisters. I think we just have to be patient and keep praying, inshallah. The only thing that you have to do, again, I'm not a psychiatrist, but what I've learned is if your mind is busy, your anxiety and panic and worry and depression will go down. So try to keep your brain involved in some sort of activity and think positive, inshallah, because this is once in a lifetime. Hopefully we don't have to go through that again. Okay. So what should a 70-year-old woman with a blood pressure issue do to increase her immunity and avoid being infected? So anyone with, as I said, with the extreme of ages, anybody who is elderly and have some underlying health condition like blood pressure, make sure you take your blood pressure medication on a regular basis, eat healthy. Okay, with blood pressure, I tell my family and friends to avoid salt as much as possible. Okay, keep your body active, walk around in your neighborhood. The immunity is it is what it is. There's nothing you can do in terms of harm it in negative way. The only thing that you make sure that you eat healthy, you do some physical activity that builds up the immunity, and washing hands and other hygiene measures you do to avoid being infected. Okay. Temperature around 100 to 101 degrees and sore throat, no pain but little discomfort. If I take cold and flu tablets, I feel okay. So if you are worried that you have these symptoms, I would get a medical evaluation. At least call your primary care doctor. Okay, they can do a tele visit, meaning you don't have to go in person, and they can triage and may ask you to do a few other things before symptoms begin. Because again, anybody with shortness of breath, difficulty breathing, and fever must be checked for COVID-19 infection, because that's very common in the community. So I would advise you to, if symptoms are persistent and are keep on happening, you should talk to your doctor. So what are the early signs? Question number 16. We have a couple of questions. So early signs are basically what we get from the data in China, okay, at this time. So early signs would be fever, you may have some sore throat, itchy eyes, loss of smell, loss of taste has been reported, and the breathing gets affected, and that's where you have to start really thinking about it. But like I said, anything unusual if you feel and you are somebody who may have had a lot of exposure and being out in the community, that's also worrisome. So always contact your primary care doctor. We have learned that somebody who may have had infection can be spreading the infection even 48 hours before the first symptoms exist. So that's why it's very important for you to avoid any type of unnecessary, because you cannot go out in the community and predict that this person has COVID infection or not, because they may be asymptomatic. They may not have any symptoms for at least 3 days before they become really, with fever and chills and other symptoms. So careful, social distance, keeping distance, avoiding any unnecessary is the only thing that you can do from your end. So last question, is it confirmed that the virus can be transferred through talking and breathing? Well, not just regular breathing that you're breathing at home. If somebody is sick, they're going to be coughing. So regular talking should not be a big of a concern, or breathing, because if somebody's breathing normally, it should not be spilling the droplets from your saliva or from your mouth. So anytime if you are in conversation with somebody who's coughing or having any issues with breathing, you have to keep a distance. So I think that's all the questions that were asked. Okay, let me go through my notes. So what do you do if you may find somebody in the community who was suspected for COVID-19. Okay, so a household member could be a family member, could be a friend. Um, so if they have not been tested or they're under surveillance, meaning they've been told to stay home, and you had somehow, got in touch with them or had some brief contact, what you should do is you have to closely monitor your symptoms and stay home for 14 days. Okay, and keep this distance. So this is somebody that you had been in touch with, a suspected COVID-19. They haven't been confirmed yet, but they could be. They are under investigation by their medical team. But you take a precautionary step. You stay home for 14 days. Keep on monitoring your symptoms, like temperature twice a day. Um, Make sure that you're not having shortness of breath and deep cough, that type of stuff. And you should also, while you're monitoring your symptoms, stay in one room. Um, okay, and go to a separate bathroom, use your utensils, all the plates, spoons, and everything separated, at least for the time until that person that you had been in touch with has been checked negative or positive. So that's the key, because you have to, again, modify your lifestyle a little bit for at least for no more than 2 weeks. Inshallah, after 14 days, you would know where this person is. So that's what I want to make sure that you also follow and write it down. Now, if Nauzubillah, if someone, your family member get infected and now they're being discharged to home, obviously you have to still, be alert and keep an eye on your symptoms, because you may not develop the symptoms immediately. But as I said, this is for somebody who has been tested positive and confirmed. You try to use separate utensils, make sure that you keep the distance, watch for fever, cough, shortness of breath, talk to the doctor, and keep 6 feet of distance from the others. So stay out of the crowded places. So all those recommendations do play a role in the public and in your family. So hopefully nobody, inshallah, will get the infection. But if God forbid, if somebody does get infected, you have to make sure that while they're being treated at the hospital, you continue to monitor and avoid all type of social gathering, and try to maintain the hygienic portion, and keep yourself at home, and not to go out, because again, it's very contagious infection. It spreads from human to human, and what we're trying to do is to cut that transmission route. So if you don't go out there, inshallah, you will not harm anybody else. So at this tough time, we just have to protect ourselves and also consider our neighbor, family, everyone that we interact with. So tough times, I know I'm doing the same thing for me, and keeping an eye, because I also work at the hospital. So this is all we can do, and inshallah, and leave it up to Allah that He eases the pain and the trials and tribulations. Um, so I will end here, brother. If there's any other question.
If there is any question from you can turn your speaker, and just if you have any question.
This is Hussein. Can you hear me?
Yes, I can hear you.
Okay, cool. Hey, thank you so much for this important topic. There are people, especially the young, who are not really taking this seriously. And, because of course they're young, they have a system, but we also see in the media that many young people have succumbed to this disease. Is it exclusively young people who have an underlying condition, or
No.
is it okay? Yeah, maybe you can speak to that if you don't mind.
So
Just
it's a very good question. No, young people, old people are all equally susceptible. Okay, so the virus does not care who it infects. Basically, doesn't see any boundaries, doesn't see any color or age or gender. Okay, so everybody needs to take precautions extremely. So they may not have any underlying condition, but it can get worse. We have seen some in the hospital, some folks who develop a rapid and fast severe reaction to this virus in young people. So both young, old, anybody with and without should take precautions, because you never know how it will interact in the body. What we have found so far, that yes, some 80% of the time people do get better, but and 20% have worse conditions or worst case scenario. But you don't want to be on 20% with the worst. So I would again emphasize the fact that it doesn't matter what the age group is. We are seeing more cases in young people too. In fact, one of the case reports was one of the infant got infected. So even pregnant women and others, so newborn. So no, don't be in assumption if you're young and healthy. Otherwise, mashallah, very good. Keep it that way. But do not take this thing lightly. It's a test. You have to be patient, and don't make any stupid action that will hurt not you, but also your loved ones in your close circle. So I think that's the key.
So if our teenage children want to get together to play basketball, for example, that is not.
I would discourage for the time being.
That's what I wanted to hear. Jazakallah khair. Salam alaikum.
There's any other question? Jazakallah khairan. And even that this was this valuable information, it was also enlightened our heart, okay, because as you're talking about our religion and how that is this, alhamdulillah, okay, that is this to be active and just using that is this to be closer to Allah subhanahu wa ta'ala. Is there any other question?
Yes.
Yes, go ahead.
If it goes down to the kidney and to the liver, so can they, can someone get out of this complication?
So the virus itself gets transmitted through your airways, the respiratory tract. Okay, so think about it. The lungs are the machines that kind of purify the air and provide oxygen to your body. So if those machines are infected or get compromised, the kidneys and other organs, whether it's liver or kidney, brain, all get affected also. So the virus does not affect directly to the kidneys or liver, as far as we know from the molecular studies. But because it's affecting your lungs that makes oxygen or purifies air, the other organs are not receiving appropriate energy. So that's how it gets affected. And if someone has already compromised function of the liver or kidney, they are hit hard. So that's the reason why when we see patients in our emergency room or other areas, we check all the labs, and if something is compromised, then they need to be treated rapidly. So they go to the intensive care unit to protect the breathing, and they may need fluids and other medication to help with the kidneys and livers and all that. So I hope that answers your question.
So does it get better, or if
lungs get better, yes, if lungs get better, the primary organs, your lungs get better, then you feel like other organs inshallah will get better too, because we have to focus as a medical community. We have to make sure that the lungs get back to the baseline, and then other function, other organ system will start recovering.
Okay.
How long this starts for the 14 days? Yeah, like my friend, she finds herself, she has the corona and she's at home. How long, from when she's gonna start the 14 days? The 14 days starts from when?
Good question. Very good question. So initially we thought that when the symptoms starts, you take that as day 1 and you go forward for 14 days. However, new studies have shown that when they start symptoms, it's kind of 3 days late. So you want to start 3 days earlier. So meaning put it like 17 days. If I were you, I would tell my friend, look, doctors are doing some new research. There are some new findings. You should stay home for at least 17 days.
Okay, Jazakallah khair. Thank you so much.
Okay. Any other question? Jazakallah khairan, Dr. Amir.
My pleasure.
And may Allah subhanahu wa ta'ala bless you and family.
Ameen.
May Allah subhanahu wa ta'ala reward you, okay, for all, okay, what you did, okay, for us, and that is all of this, okay, help. And at this point, we ask Allah subhanahu wa ta'ala to cure whoever inflicted by this disease. And we ask Allah subhanahu wa ta'ala to protect us
Ameen.
all, protect our community, protect, okay, that is mankind, okay, Ameen. Wassalamu alaikum wa rahmatullahi wa barakatuh.
جزاك الله خير.
Jazakallah.
Salam.